It's our vamp time.
It's a vamp time. Oh, vamping. I don't even know where to vamp today because it's been 2 weeks since we did the last episode. It was before Oktoberfest. I went Oktoberfesting. You never came out?
I went to Kidtoberfest.
Well, yeah, my kids.
I know my children are small, but listen, Eric Traplin was there and we got there right as he was setting up for his concert. Do the listeners know who Eric Traplin is?
For listeners who don't know, Eric Traplin is the Taylor Swift of children's musicians in KW.
That's actually accurate.
Hello and welcome to Tech About Town, brought to you by Communitech. I am Alex Kinsella.
And I'm Sacha Bell.
Today on the podcast, we're going deep into AI and pathology.
And all things med tech.
It's pretty exciting. We're going to explain what pathology is later in the episode.
Yeah.
I learned a lot about pathology in the last 2 years, writing stories about it. And it's a crazy field. There's a lot of data. The work that gets done can save lives if it's done on time. And our founder today is going to talk about that.
Yeah. Saumik Biswas is here. He's founded a company called Tenomix. And they superpower pathology with AI, innovation, and robotics. It's fascinating. Welcome, Saumik. Thanks for joining us.
I do wish we had recorded the name conversation.
Oh, yeah. Well,
explain to us again, how do you say your first name?
I guess the analogy, again, living with this for the last 30 years. But there's a movie called Jerry Maguire. And for those of you that haven't seen it yet, there's a scene with Tom Cruise basically yelling, "Show me the money. Show me the money." And he repeats it like maybe 10, 15 times.
Yeah.
And it just gets outrageous each time. So imagine show me with a K at the end. So show Meek. So during our first fundraising event, I used to tell our investors, "Show Meek the money." That's my name. And that worked pretty well, actually.
It's memorable. Saumik, you've got a PhD?
Apparently.
Wow. Doctor?
Yes.
And you're a startup founder. Can you tell me about your background? There's a story about your aunt that's very sad. That kind of brought you here.
Yeah, there's actually, I think when I think about my life, there's like two big events, and I call them my Black Swan events.
Oh.
And I'm not sure if you've heard the term Black Swan events.
Tell me.
It's basically these events that happen in your life that you do not expect whatsoever.
Your villain origin story?
I don't know about my villain origin story, but sort of what I'm doing right now, why I pursued the PhD in pathology. It's just these events that just happen out of nowhere, and it just changes the trajectory of your life and what you do. So actually, the first event that happened in my life, I had a younger brother. I still have him.
Okay, great, because
so
I was like...
No, I still have him. When he was 2 years old, he had this sort of condition called fibrous dysplasia. And basically, he was missing his tibia bone, which is the front bone in your leg. And I grew up in Niagara my whole life. So my parents took him to the hospital, and the physicians were like, "Where's his bone?" And my dad, immigrant to Canada, he couldn't really speak English that well at the time. He's like, "I don't know." Like, come on, how am I supposed to know that? So we actually took my brother to Toronto Sick Kids.
Yeah.
And the head orthopedic surgeon had a background in genetics. And he did this innovative surgery where he worked with this other company in Montreal. And he put a metal rod in my brother's leg, an intramedullary rod, technical term. And they basically created a scaffold that allowed stem cells and bone marrow chips from my brother's hip to basically grow over many, many years. And a tibia bone basically grew in my brother's leg.
What?
And he's taller than me. I'm so jealous. He's normal. He's playing basketball, volleyball, completely living a quality of life. And I was 7, 8-ish around that time. And I just remember researching into these conditions, explaining it to my parents in a very lay manner. And I'm like, man, I love innovation. So fast forward maybe another 9 years, when I was around 16, 17, that's where my aunt, I found out she got diagnosed with colon cancer at a very late stage. So they couldn't catch it early. And because of that, she passed away a year later. And that was my mom's best friend.
Yeah.
And I just remember at that age, just seeing my mom cry almost every day of the week. It was just man, I want to be able to be involved in oncology, being able to innovate. I want to understand disease mechanisms. That's why I pursued pathology.
Wow.
And then, again, just doing the training, I'm like, man, how do I get into medical innovation? Here I am.
Holy moly. That's a hero origin story.
That is a hero origin story.
Or maybe a villain, depending on how you paint it.
We'll check in later.
But I think that idea of at such a young age and seeing medical professionals use technology to really solve a problem
That is wild. That is a really
at 7.
That's an amazing story.
I wouldn't be able to. I don't think I could have processed.
No, of course. I mean, for sure.
Well, it's tough. Like when you have, like, my parents have no background in academia or medicine or engineering, whatever it may be. But I really had to sort of investigate it, just really learn the disease fundamentals. And I actually started liking it so much. And it got to a point during high school, like my chemistry teacher, my biology teachers would give me after school projects to figure out.
Because you just had a natural interest in it. Yeah.
I just loved it. So I always feel like I'm like the crazy scientist in this company. But I have to obviously operate a business as well. So, but.
And the company being Tenomix?
That's right.
Is that the company you founded?
Yep.
Okay. Tell us all about it.
Yeah. Okay. I can give you the rundown for sure. So myself, I have 3 other amazing co-founders. Evelyn Passman, she's my COO, medical doctor by training. My CTO, Mike Laftis, mechatronics, robotics engineer, brilliant guy. Sharif, he's my chief business officer, also mechanical engineer, and has run several startups. And the 4 of us basically met at this medical innovation fellowship program at Western.
Yeah.
So after I finished my PhD, I'm like, I don't know anything about business. I've maybe dived in a bit of things, but how do I need to meet the right people before I start creating my own venture.
Right.
And that program really allowed me to find my people, my 3 co-founders, and we were able to work on this problem where pathology staff are basically looking for lymph nodes and surgically removed cancer tissues.
Yeah.
So the whole point of the program was interview doctors, figure out their pain points, develop a technology, and at the end of the program, you can decide whether you want to start a company or license off that technology if there's IP behind it. So throughout that 10 and a half months, we really interviewed doctors across Canada, the US, Europe, Middle East on this particular lymph node problem.
And did you find like they were all having similar issues?
Yeah. And it's just, we constantly kept on hearing the same thing. Like, it's a very labor intensive problem. It's unreliable. It's not really accurate. And it becomes scary because I think about my aunt's situation. And this process that we're trying to solve right now, what happens is when someone gets diagnosed with colon cancer, they undergo surgery. Surgeons go in, they cut out the tumor and the surrounding fatty tissues in the gut or in the intestines, and they take out this massive tissue sample. They send it to the pathology lab, and someone's literally using their hands, digging through the fat for hours, trying to find these small lymph nodes that are buried in the fat.
Jeez.
So sometimes it's like finding a needle in a haystack, if that's the analogy. And we work with some amazing clinical partners, and we started finding from our studies that the average error rate, or at least from that one study, was 50%. And this is a little bit concerning because when they find these lymph nodes, they take them out, they send it for more testing, and those results through pathology determine if you're stage 2, stage 3, or stage 4 colon cancer. So with my aunt, I do always think about, did they do this process properly for them to properly stage her cancer? Maybe they weren't able to, right? So basically what Tenomix is doing, we're building this novel benchtop robotic scanning device that uses ultrasound imaging and AI. And our whole goal is to automate this process in a way where we can make the lymph node search process less labor intensive, less expensive, and more reliable for pathology staff. And hopefully this will lead to better patient care.
Saving lives.
Hopefully. Fingers crossed.
When we had like our pre-podcast call, I was just like, this is an amazing example of AI actually doing something, because the AI hype cycle is on fire for things right now. And then to hear this and go, okay, it's AI and robotics, because you're doing automation of that detection for lymph nodes.
Exactly.
Like how do those two things interplay, right? Because we always hear about AI, but we never really hear about AI in a more of a physical world.
Yeah, well, that's sort of the beauty of where the landscape's going right now, because you're hearing about this huge boom in AI technologies, right?
Yep.
And that trajectory of growth has been substantial in the last few years, right? With NVIDIA's chip, the GPUs being able to power sort of these AI computational powers, like it's just amazing. And the hardware side, it's going to catch up at some point. And our device, it's such a nice intersection of both hardware and software. And you imagine like this robot that we've built, it's like this robotic gantry system. And the idea is you take the tissue, you place it into a device, you press start, and the robot activates where it uses ultrasound imaging to collect images of the sample as it's scanning. So those are the inputs for our AI. And our AI is then analyzing those images to find lymph nodes automatically. It sort of starts mapping out where the lymph nodes are, their sizes, and several other clinical information. and it then tells the robot to physically mark where the lymph nodes would be in the actual tissue. So when you have a combination of both hardware and software, you start really getting into this more physical world. But the other opportunities are that you start really scaling the applications of technologies for so many other clinical applications, right?
Like what else?
So hopefully other cancer tissue types like breast, head and neck, stomach cancer, prostate cancer, what we're really trying to do is really leverage the capabilities of ultrasound imaging and bring it to pathology for the very first time.
You're hard pressed to find a human on this earth who hasn't had a friend or family or themselves affected by cancer, you know?
Well, and with this too, like a lot of applications of AI and imaging, it seems to be like existing imaging technologies, right? So you're taking MRIs, you're taking some other scan, and it's still computer vision technically, right? Even though it's ultrasound, right? But you're doing kind of a new visual sense versus using existing sensor technology.
Exactly. So like ultrasound is nothing new, but the thing with our technologies, we've integrated all these components for the very first time in pathology. And just to give you an example, like in pathology, they don't use ultrasound whatsoever. So when we go into our hospital collaborations or clinical partnerships, we're scanning colon cancer tissues, building that image database, labeling those images for lymph nodes, and then being able to train our AI model. So it's a bit of a customized AI model because that data just doesn't exist right now. So we've been in the lab literally scanning and collecting these cancer tissue image data.
Can I ask you a really dumb question?
I'm sure it's not dumb.
Please define pathology.
Oh my God.
Were you going to ask that?
I know it just because I worked on some other pathology thing.
But it's diagnosis. Diagnostics, right?
Well,
no, tell me.
I love that question because I feel like with investors, with anybody, pathology always gets the brunt of medicine. If maybe I'm biased, but pathology is literally establishing the gold standard of medicine. So you imagine if you're going into the ER, you're getting blood work done, or you're going into the hospital getting a biopsy done, all those samples are being sent to the pathology lab, and pathology staff are basically investigating those tissues at either the cellular level or more at other sort of at the lab level. And they're basically trying to determine what the cause of disease is or what the disease exactly is.
Okay.
And that pathology report that's generated is sent to the oncologist or sent to the other physicians where they can base their treatment decisions off of.
Gotcha. It's like a report of like what we think is making them sick. It's like a detective.
Yeah, but the thing is with pathology, it's not patient facing. So
right. It's in the lab.
It's in the lab.
In the back.
So you imagine like these people that are just hidden away from society, but it's so important medicine because you can't build a definitive diagnosis without pathology. It's hard. It's really hard to do that.
And that's the part that you're kind of giving the superpowers to.
And that's what our hope is to have more awareness on what pathology staff do. Because I grew up with a bunch of pathologists during my training, and it's a lot of work that they're taking on. Like you hear about all these new genetic technologies, sequencing technologies that are coming out, giving physicians such a granular detail of someone's health condition. You can't have that without the help of pathology staff, right?
Yeah.
And the other sort of thing here is that, obviously you have the surgeons doing their thing, taking out these samples, but when you have these new downstream technologies that are happening, everything in the middle, like sample processing, sample like assessment, it gets forgotten about. So what ends up happening is you get so much stress on pathology staff having to basically put more work in to be able to catch up with all the demands that they're facing from other physicians or just all the demands from like turnaround times on the reports. So that's what we're trying to do with our technologies. Come in, how do we best help them and equip them with the right tools so that they can help provide the best patient care?
Wow.
It's like when you watch a medical drama on TV and it's always like, we're waiting for the lab.
Yeah.
That's the lab. You're actually going to take that plot device away. They're no longer going to be able to wait for the lab because all the tension's gone, which is a good thing, I guess.
Well, you guys remember COVID, right? Like when it first happened in 2020 of March.
Right.
When people needed lab results on like, do I have COVID or not?
Right.
You guys remember the buildup of all the, like the lack of resources for pathology lab. They just couldn't process all those samples.
One thing that's pretty interesting is that you're part of a couple different ecosystems. You mentioned the fellowship program at Western, which is, I've interviewed the founders at Vessel, so another successful startup that's coming out of there. You just walked across the street from Velocity's new space, and then you're part of the MedTech Accelerator here. When you're looking at those programs and the support you've gotten from them, how have they helped? And then what gaps still kind of exist for you as an entrepreneur bringing this to market? And I know we've talked like there's procurement challenges. There's the differences in selling into the US versus Canada. Kind of what's been your experience?
That's a loaded question, Alex. I can start with the first question. So for us, what I've realized over the years, like when you're building a med tech company or any product in medicine or life sciences, it actually takes a village or a community to build that startup from the ground up. So for us, when we're obviously part of different ecosystems. So in obviously with Waterloo, with Velocity Communitech, we're part of the London's ecosystem, BioNext, Western University. We're part of a lot of different groups in Toronto as well, Mars, Obio, Next, huge group of individuals that have supported us from the get-go. And what I mean by that specifically is that in medicine, when you're building a technology, there's so many different components that you have to think about. It could be R&D, it could be usability testing with clinical partners. What does that process look like? Financial modeling, business model, pricing strategy, regulatory, quality management systems, intellectual property, IP strategy. There's a ton of stuff. Financing, right? I saw you breathing a little bit heavily there when you start thinking about all the
It's a lot.
But the thing is, with each of these ecosystems,
How can you do it all?
Oh man, I have an amazing team. But the beautiful thing with our ecosystem is there are so many different mentors, workshops, just learning resources that we've been able to really benefit from. And specifically with Communitech, like we have some amazing mentors. Shout out to Liz Monroe, Jan, RJ, Paul Weber, a lot of amazing mentors who have either gone through the process themselves and they've been able to tell us about some of their battle scars or battle wounds, like what they've gone through when they started their company. Or maybe they've worked with a big multinational company in the sales side. So they've been able to inform us with that information, which has allowed us to build this foundation of knowledge. And as we're sort of going through our own journey, we can sort of reflect back on their experiences and that information and be able to iterate sort of our decision or next steps that we would take. So that's a huge part of why we're involved in different ecosystems. In terms of areas of where I think there could be some improvement down the road, we obviously completed our first financing round about 8-9 months ago, and we were raising throughout 2023. And I'm not sure if many people remember this, but 2023 was like the worst time to raise. It was so tough.
We sadly remember, but yes.
Yeah.
Go on.
No one wanted to invest in new companies because the markets were like wonky, right? So one of the things that I sort of realized is when you start having accelerator incubator programs that have sort of investors sort of intertwined in that ecosystem, you can start having early touch points or conversations with those individuals. And a big thing with investment is it's really building that trust with those individuals. And obviously you need to have a great business and great technology, but that trust factor is a huge part of why we were able to be successful in our first financing round. It took a bit of time. And just to give you guys just some context, I pitched to 205 investors.
Wow.
And we had about 16 investors translate or convert. So
Wow.
that's roughly about 7-ish% conversion, which I've been told it's not bad. But just to show you, and it's all Canadian investors, by the way.
Cool.
Which is great. But our lead investor, Facet, again, huge group, great group who are supporting early stage innovations, oncology innovations from Ontario. So they actually funded us with a grant back in our early fellowship days. And because we were able to hit all of those milestones, they loved what we were doing. They believed in us. And that was a result of trust and understanding the team's capabilities. And they actually ended up leading our round, our last financing round. They led with $1 million.
Wow.
Because that trust factor was there.
Well, and you're proving yourself.
That too.
Yeah.
That too, right? Because I'm a first-time founder myself. I have the clinical background. But again, you need to build that credibility, that trust.
Yeah.
And that was a huge part of what I like to see future accelerators and incubators include more, is more of these like investor networking events, which I think Communitech Velocity is doing really well, right? And I know a lot of the other ecosystems like in Toronto, like Next, Obio, they're constantly holding these investor events. So it's getting a lot better.
Well, we just had our biggest investor event of the year, Oktoberfest.
There you go.
It was all about investment.
Yep.
Capital VCs.
Investor House.
It was called Investor House.
But
Spelt Haus.
Yeah.
well, you guys, that's the thing. Like you guys are leading the way, right? And we need more of those events.
Yeah.
To have more of those interactions, those collision events.
I think that we, capital W Communitech, we've been hearing that a lot from founders, that capital is really the challenge right now. And I had a really long chat with Jameek Beckford, who runs Waterloo Youth Programming out of Communitech Hub yesterday. And we had a long chat about just how FaceTime and those interpersonal skills, he teaches and mentors youth across the region. And he's like, I just try to explain it to them that's that trust building and that those relationships, like that's what life is about. And that's what being a successful human is all about. And there's no shortcut. There's no quick scheme to get ahead.
No.
Other than that, you got to go. That's how you got to do it.
There's no ChatGPT for building trust.
Can you imagine? If only for those AI hallucination events to give you all the wrong information.
I love the hallucinations.
What are you talking about?
So like if you ask ChatGPT, like it'll do it where like you ask it to summarize like a court case, but it'll make up stuff about a court case.
Oh.
So I tried it once, just a total aside. I was like, hey, can you pick out like 4 or 5, like, I didn't say banger quotes in the prompt, but I'm like banger quotes from this transcript. Like what do you think are banger quotes in this? And it came back with some great quotes. I'm like, I don't remember that actually happening. And I went to the transcript and I would say, give me 4 quotes and 3 were completely fictional. Did not happen in the interview. And the 4th one, it reworded it like if you were correct, but you don't fix quotes. Like it's a quote's a quote, a quote. So it corrected it, and it corrected it in a way that changed the actual what the person was saying.
Yikes.
It was a really good quote. If I could make stuff up, it'd be great.
But you're a legitimate journalist. You wouldn't never do
so
that.
I tried and I learned. And
I will say their models are getting a lot smarter, though. I'm not sure if you've tried the recent, I think the 40.
I've tried,
401.
I don't know.
I've been following a lot about the Microsoft buying 3 Mile Island,
for the power,
and like how that's the next thing, and that they just found a lithium mine in Oklahoma or something.
Arkansas, or Arkansas, as they say in Russia. We're not supposed to talk about Russia anymore.
But those are the news stories that I've low key been obsessed with, which is like not only AI, but like how are we powering AI and the consumer not really realizing that like how much processing power it takes to build a society on AI.
I mean, we don't have to put this in the episode. I'll just ask anyways. But like
Alex,
with your
I
model,
sound really smart. We should keep it in.
We'll keep it in. But with like your model,
Yeah.
is it cloud based or is it on premise?
Yeah, that's a really good question.
And you don't have to. I mean, like we'll cut that out if that's like a proprietary.
Yeah.
Is that give me all your IP?
Yeah, no problem. So right now, as part of what's powering our AI, so that's actually a pretty hot topic right now.
For sure.
We're actually using one of NVIDIA's like new computer chips.
Okay.
And that has capabilities to the cloud. So for our first device, it's going to be mainly offline for the most part. So for example, like what we're sort of envisioning for the first rollout is a device. And when we have firmware updates, we'd have like a technician or an engineer person go to the hospitals physically and sort of update the hardware firmware as needed. But down the road, as the infrastructure for AI gets better, especially for pathology labs, cloud-based computing is definitely going to be something that's going to be on our radar for sure.
Yeah. It's interesting because I feel like we made such a big push to edge.
Yep.
And like, what's edge computing? You're asking.
My eyes say it. You and I are getting to.
We're getting better.
We're getting to know each other very well.
So
you know the look in my eyes. Sacha doesn't know what that is.
In the world of cloud-based computing, basically you have sensors on something. You have a robot, it's got sensors. You've got a camera, it's a sensor.
Yeah.
It usually would send its information back to the cloud or some on-premise thing, and it would process it and do what it needs to do. Mm-hmm. Edge computing means it can do it at the location. So it would, like, if you have a robot...
It doesn't have to go to space and back and then come back?
Yeah, it would do all its processing locally and figure out what it needs to do, and then like let the home base know, hey, this thing did this thing, and you're good to go. But with AI, you need putting that kind of processing at the edge. on device. That's why I like the Apple Intelligence stuff.
Yeah.
Which is not an ad for Apple, but that's why you need like a new iPhone, because they need the processor, the right processor
different hardware
to do it at the edge versus sending all your personal data back to Cupertino.
So you're saying like if I go on my iPhone and I plug something into ChatGPT, it's got to send it back to ChatGPT headquarters and then come back. Whereas if it's using the edge technology, it's all happening on my phone?
Well, yeah, that's what edge
is that the idea?
Yeah, it's happening local.
Yeah, well, so speaking of power, actually, I'm part of a CDL reading group that takes place every month. And
what's CDL?
A Creative Destruction Labs. And it's a great program that came out of Toronto. And we were invited to the reading group from our participation in the Next programming in Toronto as well. But one of the topics was about this particular article by Leopold that talks about where the future of AI is going. And there's sort of this discussion about power requirements in the next 20, 30 years. And what sort of trends that we're seeing apparently is some of these AI companies are building these large or gathering these large power contracts, all right? Like nuclear. I think Google recently announced some announcements about buying nuclear plants to power their future AI tools. But the thing with a lot of these power contracts is they're like 10-year contracts.
Yeah, well, they're like, we have to build a nuclear power plant. That's not happening overnight.
Exactly.
Sure.
So they're super long-term contracts. But the thing is, a lot of these companies are focusing on acquiring those contracts right now, trying to build that foundation for future, for the energy requirements that all these AI tools are going to use. So it's going to be a interesting couple of years.
The power thing blows my mind.
The like compute power is needed. I know, it's crazy. To bring this back to Saumik, because I don't want to get too off topic.
Sorry.
It's all AIs, which is great. But I feel like if you go into the comment section of anything on social media about AI, this is what ideally as a society, we should be prioritizing, like this amazing innovation and this leap, this like exponential leap we've just made in technology. It's like, it should be used to help cure cancer. And that's what you're doing. And it's so cool. It's like, this is what we want. This is what we want that energy to be.
It's good AI.
It's tech for good.
Oh my God, look at all those, all the keywords.
Yeah, absolutely. It's AI could be used for so many different things. And obviously there are concerns about AIs being used for war or, for security intelligence, right? There's all those concerns, but the good that AI can do is also substantial too, right? So there's sort of both sides to the coin here. And my hope or my hopeful future vision for Tenomix is that we're actively utilizing these new technologies that are coming out and sort of combining them in a way where we can hopefully add benefits to society.
And what is that? What's next for Tenomix? What's exciting?
Yeah. So for us right now, we actually just hired a director of software 2 weeks ago.
Ooh.
7-time founder, exited I think half of his companies.
Wow.
Former Canadian, and I think he lives in San Francisco. He goes back and forth.
That's a get, as Alex would say.
Yeah. And he was at doing AI work before AI was a thing.
Yeah.
So we actually have him on board, and he's just been, I guess, drinking from the fire hose. But no, he's going to be helping build the AI sort of infrastructure that we have for our technology.
Yeah.
And parallel with all the work that my amazing team that we're doing right now. So our next sort of goal right now is we're working with a manufacturer right now. They're building us the pre-commercial unit for our device. We're hoping to get that in Q4 of this year, fingers crossed. And it's basically this like consolidated unit that does not look like a prototype anymore. It's sort of almost like the real deal. So our goal is to basically get that device, do some benchtop testing, and collect more user feedback from hospital partners, which I can talk about shortly. As we get that feedback, we'll iterate the design of the device as needed. But I think we've done a pretty good job with all the usability testing we've done over the last 2.5 years. So once we get that done, our next step is to look into regulatory, which is what we're doing now, and really start having conversations with FDA and Health Canada, get a sense of, this is our clinical testing plan. This is what we're proposing. Do you agree with it? Basically, so getting more validation from regulatory. And then as that's sort of being set up, what we will do next is start figuring out who our clinical partners will be for our longer term clinical studies. to prove out the performance of the device and whatnot. And then we would roll out during that time period, basically.
So what kind of partners do you need to make that happen?
Yeah, so we're basically looking for academic hospital partners that, really believe in innovation and in the advancements of new technology and bettering patient care. So we've been super fortunate. One of your questions, Alex, was, you talked about procurement and, engaging with hospitals. This Velocity event that I was just at, it was great to see these 5 startups pitch to different hospital partners across Kitchener, Toronto, Hamilton, right? And getting that exposure up front is super important because you'll start engaging with the early adopters of your technology.
Yeah.
Right?
And hearing their questions. And
exactly. Exactly. And the thing is, you need to work with clinical partners if you're building something for the clinic or for the hospitals. And finding those early partners is a huge part in what we're building, right? So we were super fortunate to be working with one of the leading hospitals in the US and technically the world, and also several other Canadian hospitals that have just provided such immense value to us as individuals and to our company from a technology standpoint that we've been able to iterate on the design of our tech or really start answering other questions on the clinical problem. So there's a lot of things that we were able to uncover with those partnerships. But so basically what I'm saying here is when you have these incubators, accelerators that are holding these types of events to meet with hospital partners and being able to align with the values that those hospital partners have with your company, then it's a great match. And definitely you should go for it. I'm not sure if I answered your other question.
We're just here. We're along for the ride.
Okay.
Yeah. No, you did.
Thank you.
Hey, what's the future of Tenomix? What's your vision?
So our vision is to essentially be at the forefront of pathology innovation, where we can equip pathology staff with the right tools that help provide best patient care. And basically, the world that I'm envisioning as AI is getting bigger and as the hardware capabilities match up with the software, I'm sort of seeing this future with healthcare where obviously right now there's sort of a screening process that's being done, sort of that diagnostic step. There's a prognostic step or a treatment step sort of in between. And throughout each of those stages, there's multiple different touch points that are happening right now, which right now it's either manual, like super manual, it's super inefficient. So what I'm sort of envisioning for healthcare is that there's going to be all these tools that are coming in that help streamline from one end of healthcare to the other end. And our vision at Tenomix is to really be able to build these platform technologies that can be used for multiple other clinical applications down the road. So I mentioned ultrasound imaging, right?
Yes, right.
The first use case for us is going to be colon, but we'll be able to use ultrasound imaging and start scaling it or expanding it to other clinical applications in pathology, right? For different use cases. So how do we build something that has a high utility for hospital staff?
Like can scale.
And can scale.
Yeah.
Right? And hopefully provide a ton of benefits for patients, the labs, and just the general society.
I was going to say an ounce of pathology is worth a pound of cure.
It's pretty good.
I might use that for the episode.
And that can be the title.
There you go. We solved our problem. Well, listen, thank you so much for joining us today.
Thanks for having me, Alex.
Yeah, no, this has been probably our best episode. This is it's such a great story, and it really is looking
at... It's just so important. I've really drank the Kool-Aid working at Communitech, but when I meet founders, they're just like, oh, I just identified this massive problem in society and I've committed my life to fixing it. It's like unbelievable. It's amazing.
Yeah. And I like to see it too when it's an application of a mix of existing technology and new technology to solve a problem that saves lives.
And it's at the right time because it's just at the beginning of what this can do. And you're developing this with the understanding that we're going to be flexible and it's just going to grow and evolve as the technology does. It's great.
Thank you. Well, thanks for having me. I enjoyed the conversation. And thank you guys for sharing the awareness on all of the startups in our ecosystem. Because you mentioned Vessel initially. They're just crushing it. They're grinding away.
They're the prosthetics company?
Sydney and
They just won our pitch competition at Oktoberfest.
Yeah. But just showcasing all the different startups that are coming out of our own ecosystem, that's like the biggest step, right? Creating that awareness that hopefully that will generate more leads for them too.
Yeah, we're here to shine a light on the best of Canadian tech.
Well, thanks again.
Thanks, Saumik.
Thank you.
Dang, saving lives.
Yeah, we talk a lot about tech for good and good AI and all the other keywords we use for SEO. This was a great example. Like I remember when we did the pre-call 2 weeks ago. I was like, I got off the phone. I'm like, I'd go work for him. Like, it's such a great story. It's technology that's actually making a difference. There's a lot of challenges, both in like bringing the technology to market, getting into hospitals in the US and Canada, but I think he's got the right connections to make it happen.
Yeah, I can't wait to see where Saumik takes this. It's going to be incredible. Saving lives, changing the world.
We should start like seeing if we can get equity for having people on the podcast.
Yeah, please give us one share.
Give us
each.
a share. Just one little, oh, that'd be great, eh?
Help me, I'm poor.
Yeah.
Just kidding. Yeah.
Well, thanks for joining us. As always, if you have comments, questions, suggestions for guests, you can find Communitech on all the major social media platforms.
But Alex, I need to tell you about Communitech.
Oh, you got to tell them about Communitech.
Communitech is an innovation hub. We've been here for 27 years in downtown Kitchener. We help tech companies and entrepreneurs start, grow, and succeed by supporting them with talent, access to markets, capital, and community. And if you want to learn more about supporting your startup or scaling company, you can slide on over to communitech.ca. And if you are a partner, which is an organization outside the tech space that wants to plug into our community of tech and help support the growing innovation ecosystem here in Waterloo Region, you can slide on over to communitech.ca and click on that old partnership button and come partner with us.
Anyways, thanks for listening.
And goodbye.